Okay. All right, we'll get started. I'd like to welcome everyone to our January Masterclass, our first Masterclass for the year. This Masterclass is Purposeful Progress, Integrating Goal Setting and Sustainability in Veterinary Care. My name is Claire, for those of you that don't know me. I am the Programs Lead at Vets for Climate Action, and in just a moment, we will be hearing from Paul Ainsworth from the Lincoln Institute of Veterinary Business. Before I continue, though, I would like to acknowledge and pay my respects to our First Nations people, past and present. Traditional owners have cared for this country upon which we work and meet for over 60,000 years. Its lands, oceans, rivers, its trees, and wildlife. We endorse the Uluru Statement and acknowledge that this land has never been ceded. Just a few housekeeping things. Would you please have your microphone muted during Paul's presentation, unless you have your hand up, or you can pop questions in the chat, but Paul has mentioned that he will be having an interactive session tonight, so that's up to you. Just a little bit about Vets for Climate Action for those of you that don't know much about us. We represent concerned vets, vet nurses, vet practices, and industry partners across Australia who want climate action. At Vets for Climate Action, we are working to inspire and educate both within the veterinary profession and to the wider community. We promote sustainable veterinary care through our Climate Care program, a world-first management tool designed to reduce greenhouse gas emissions and increase sustainability in veterinary practice. At Vets for Climate Action, we are the voice for all Australian animals, and we invite you to become a champion in your community and strengthen that voice. Just a quick intro about Paul. Paul Ainsworth is the founder of the Lincoln Institute of Veterinary Business and has been working with veterinary professionals in the field of non-clinical skills for 15 years. Thank you, Paul. Take it away.
Thanks, Claire. That sounded okay, Claire. I know we did a sound check earlier, but then I switched to headsets. Is that okay?
Yes, I can hear
you. Okay, great. So would you mind just jumping in the chat, everyone? Well, the good thing is that we've got not a particularly large group, but we've got a meeting as opposed to a webinar. Could you just jump in the chat and just let me know where you're dialing in from? Would be great. Thank you. Because no one's got the cameras on, I don't know who's actually there. If we get nothing, then I'll talk at you for 45 minutes. Oh, nice, Caitlin. I know you. Hey, Michelle. Okay. It's a packed house. That's okay. We'll have some fun with it anyway. And I think this is going to go out as a recording. So thanks, Caitlin and Michelle, for just turning your cameras on. We'll make it a little bit more interesting if we can just chat about this stuff rather than just me talking at you for a long period of time. I tell you what I'd like to do is I'm just going to start first of all by just checking in on your New Year's resolutions. I happen to have hacked you already, so I know that your New Year's resolution. How long do you think your New Year's resolutions last? Any ideas? Someone researched this. I think they need to get a life personally, but they actually researched it.
I'd guess 3 months.
That's pretty optimistic. Michelle, any ideas?
So 2 to 3 weeks.
Yeah, 2 weeks. No, 15th. Woo, 15th of January. That's when most New Year's resolutions die. And look, I think, you know, within the context of how we're going to frame it up, Sue, hello, welcome. Thanks for turning your camera on. Within the context of what we're going to talk about tonight, I really want to sort of get into some of the work of James Clear in terms of why New Year's resolutions die by the 15th, why it is that we find it so hard to achieve new results and change things. And if we're thinking about the work we want to do with climate, it's going to require some significant change. and we could branch off into how we lead change, and we might even do a little bit of that, Claire, just sort of how that might be more effective, how that might be really sort of helpful, or maybe we'll save that for another masterclass, see how we go. So this one I want to talk to you about is how we set goals, and then why goals fail, and I want to touch on two other points around this concept of intensity versus consistency, and how that plays into our ability to achieve goals. And I'll sort of expand on each one of these as we go. I'm going to draw on some specific examples, some veterinary examples as well, and tie those back into the content. Thanks, Michelle. If you wouldn't mind just muting, there's a bit of background noise.
Sorry.
No, that's okay. That's all good. So you may well, it sounds like, Caitlin, you may well still be hanging on to your New Year's resolutions. Did you make any? Can I just ask?
No, I don't tend to do New Year's resolutions.
No. I heard a really cool one. It's a bit macabre actually, but I heard this really cool one. He said his New Year's resolution was to live this year like it was his last. And he said that might sound really macabre, but he said, I just don't want to do stuff that just, he said, I'm very happy to watch a bad movie with my kids, which I thought was just a wonderful sort of, overarching theme around his year. But anyone else who's got some New Year's resolutions, we're just going to work towards how we can sustain them. The first thing we've got to do is we've got to turn a dream into a goal. Because if you set a goal and you don't put some specifics around it or a time frame around it, don't make it achievable, don't consistently check in to make sure it's still relevant that you're doing it in the first place, then really you're just wasting your time. And so I think most people have heard of SMART goals. Is that a fair assessment? Yeah. But I think there's a lot of nuance with SMART, and I think we can sort of get into the detail to really work out how that plays through. So the first one is the S stands for specific, and it's not just specific about where you want to get to, it's specific about how you're going to start, because most things don't actually get off the ground. There's no sense of urgency to change. Resistance to change is usually pretty strong in people. Fear of the unknown. It's fine the way it is. We discount the future massively, which I'm going to talk about later on. And so unless we actually get really, really granular about what we're going to do next week as a starting point for a goal, we're not going to get there. So it's not just about the end, it's about the beginning. The M stands for measurable. Sometimes it's really hard. I mean, some things you can measure, quantifiable things is really easy to do. But if you set a goal for raising your clinical standards this year, I have a military background, and a lot of the time we spent in the army trying to improve what we were doing. And so you kind of think, well, we're not at war. I don't know how well we'd cope under pressure. And so you've got to pair it back to the next best thing. It's exactly the same with you in practice. We're going to pair it back to, if you're going to raise the clinical standards, the one thing we can measure is the amount of training that you do and the quality of the training. And so if you said, I want to raise, if it was my practice and you said, Paul, it's time to raise our clinical standards, I'd be saying, right, so what does that look like? Now you can measure less mistakes and you can try and do those things, but then, how long's a piece of string? It becomes very, very messy. But what I could do is I could say once a month, we're going to run training for the vets, and we're also going to run training for the nurses. And the training is going to comprise 12 things over the course of the next 12 months. Each month, we're going to hit those things that I think are really, really important. And you could identify what they are. A lot of the coaching clients I've dealt with over the years, I remember one real standout. She said to me, Paul, we're referring my way to, we're not making any money. And I said, so how's that? What's changed? And she said, I refer everything. She was in her 60s. She said, I refer everything and I've lost my mojo. And I said, so how do you get that back? That happened in the past, and we explored what that looked like. And the next time we caught up a month later, she'd done a whole stack of work to improve her mojo. I think basically she watched YouTube to just get her head back into what was involved in procedures. But I think that's a really good example of where you could say you will have a clinical team that don't do certain procedures, lots of things on a regular basis, but stuff they don't do all the time. And so you might therefore look to raise the clinical standards by running clinical training or surgical training, or even just basic standards of care, reducing infection rates for overnight patients, making sure that those people that are monitoring the anaesthetic know exactly what they're doing. So that type of thing, you could measure the fact that you've done 12 training sessions. You could say it's compulsory to attend 10. There'll be times when you won't be able to attend, but you must attend 10. And the end of this year, we'll know that we have, in some measurable way, improved the quality and the standard of care of our patients. So that's the end. Other things are really easy to measure. So just measure them. Achievable. Don't set a goal that a dead person could do better than you. So what that basically means is, I'm never going to eat chocolate again. Well, firstly, it's a dumb goal because chocolate tastes too good. But secondly, if a dead person can do it better than you, don't do it. So find another way. Find another way to describe what the goal is. So our goal is not to stop doing something, but it's to start doing something else. So it might be, chocolate's a really easy example. It might be, I'm going to limit the amount of chocolate I have, and you might put a number around that. Okay, so that's achievable. If you want to achieve what it is that you're going to do, let's say it's go to the gym more regularly, and set some goals around that. Don't do it at 5 o'clock in the afternoon if you've got kids. It's just a stupid idea. Like, you'll never do it. So you might have to think hard about when you might find the time or allocate the time to be able to do that, and make that sensible, like early in the morning. And I'll get into the system that supports this in a minute. Relevant. This is quite problematic for a lot of clients I work with. Why? Because a lot of them have perfectionistic tendencies. And the difference between very high standards and perfectionism is the unintended consequences of perfectionism, negative consequences. High standards is great. When you tip over the balance into those perfectionistic tendencies, where you can't possibly be wrong, how could you be wrong? Why would you ever need to rethink anything? Why would you ever need to actually reassess the way you might be approaching something when it's already perfect? It must be perfect because you thought of it. And so continuing to do something that's actually not really achieving results is probably not a great idea. So make sure that you're constantly rethinking whether what it is that you're doing is relevant. Are you improving things? I had here's a really simple example, but a few years ago, I know that cardio is really good for me. Like, my PT said, or the doctor said, second to quitting smoking in terms of health. There's no correlation with losing weight, according to him. I thought, yeah, whatever. If I get on a running machine and I belt it out for 45 minutes, of course I'm going to lose some kilos. But then I started to actually measure what was happening. And I was on the running machine, no problems. And I was belting out a lot of calories. And then I was consuming them about 20 minutes afterwards, easily. In about 5 minutes flat, I'd consume all those calories plus some. So for me, the relevance of cardio, when cardiovascularly, I was actually fine, but we can all do a little bit more. But the real issue for me was I was actually trying to lose some weight. So I had to shift to a different style of cardio to actually get the results I was looking for. So that required some rethinking. That's just one example. You might, for example, decide that one of your goals might be on the business side within the clinic, and then you realize that actually by making the decision that you've made, you've actually caused more harm than good to the practice. And so you have to rethink that. I know a lot of practices that came out of COVID had gone from 15 to 20-minute consults to 30-minute consults. They had to rethink that 2 or 3 years out of COVID, because by reducing the number of consults that you're doing by up to 30% a day was really having a detrimental effect on the books. But that might mean you have to rethink the style or the training or how the consult plays through. And the last one is time. If you don't put a time on a goal, it's a dream. You have to put a time frame on it. So that's SMART goals. Okay, so I think if you're going to set a goal, that's the first thing you've got to do is you've got to create that sort of put some science around the goal and make sure that the goal is actually, sort of achieving those things. Once you've done that, the tricky thing you've got to do now is, which is the hard part, is you've actually got to take the goal and almost forget about it. Stick it on the shelf. Because you spend too much time focusing on the goal, you'll think you're achieving it and you're actually getting nowhere. And the reason why that's the case is we are perfectly designed right now, perfectly designed to achieve our current results. We couldn't be any more set up to achieve what we're currently achieving. So if you've got a new goal, you want to change your goal, change the outcome that you're aiming for, we've got a problem. Because let's say, for example, your goal is to go to the gym and you say, oh, well, I'll never get there in the afternoon because it's all work and kids and that sort of stuff. So I'm going to go in the morning. But your current habit is to get out of bed at 7 o'clock in the morning, roll out of bed and be ready to go and out the door at 7:30 in the clinic by 8. That habit is automatic. You don't have to think about it, which is what a habit is. And now all of a sudden you're spending you're trying to achieve a new outcome and continuing to do exactly the same thing as you were doing before. So that's why we fail. And so what we've actually got to do is we've got to look at the system that sits behind the goal. And this is why we identify the goal, make it smart, sit on the shelf, and now we've got to focus on the system. And the system comprises two things. And I'm going to circle back to this at the end. The system comprises, first of all, habits. And the second one is rituals. So habits and rituals, and you can get into semantics, but I'll sort of give you a couple of examples of that as we sort of go through the webinar. Before I touch on that, I want to touch on two other things that James Clear points out is really, really important. The first one is that we discount the future. So here's an example of discounting the future. If you have 1 teaspoon in a cup of coffee and you have 2 coffees a day, you will consume 7.3 kilograms of sugar next year. That's discounting the future. That's the, she'll be right. I'll just do the teaspoon. It's just a teaspoon. But it isn't. That teaspoon translates in 700 cups of coffee to 7.3 kilos. You would never, I don't think you would. Reminds me of a board meeting I was in once where the chairman of the board asked for a cup of coffee. So he's sort of walking around the room and he goes, it was actually at ALDI. And he goes, when I was the director there, and he goes, the guy says, oh, would you like a cup of coffee? And he said, yeah, I'd love one. And he goes, oh, would you like sugar with that? And he said, yes, just 4. Anyway, maybe you have a lot of sugar. I found that very funny. In fact, I burst out loud laughing, which didn't go down very well because they're all German. But so that's that is a classic example of discounting the future. You wouldn't sit down and eat 7.3 kilograms of sugar tonight, I don't think, with a teaspoon, because you would know the impact of that. But so much of what we do in society right now is so geared around not caring about the little things, right? So, guy loses 50 kilos in body fat, right? Great headline. Guy eats salad for dinner. So you can see where I'm going, can't you? Right? We love the headline. That's what we focus on. Now, James Clear has another term for this, which is intensity versus consistency. And there's a couple of really simple examples of this, I think. If I said to you that this year you're not a reader and you're tired and all the rest of it, but this year it's going to be really important you read a 700-page book. So pick a 700-page book and go, how am I going to get through 700? Now, what happens is, if you're the intensity person, first of all, after you sort of pick yourself back up again, you kind of go, there's no way I'm going to get through 700 pages. And you try and plow through 30 and you fall asleep and you just don't get into it. But if you read 2 pages a night, you get through nearly 800 pages of book. And there's so many examples, isn't there? Can anyone think of another example of where you just do a little tiny bit each day? Anyone done that?
Exercise count. Just a little bit.
Sorry, what was that one?
Just a little bit of
that,
exercise
Claire?
every day adds up.
Yeah, it does. Like if you said, I want to walk a marathon next year, you go, oh, you know, get the t-shirt, get the posters, get the kids out on the side of the road, ramp up the whole thing. If you parked your car 100 meters away from the clinic, as long as it was safe to do that, you'd walk 42 Ks to and from your car. Michelle.
Yeah, I'm thinking of the example of the Shawshank Redemption, where he dug the tunnel and each day he took out the stones in his shoes.
That's such a great example. Yeah, classic. What a great movie. Yeah. So we're talking about sort of discounting. I think they're close cousins, discounting the future and how long it's going to take to achieve certain things, but also this sort of consistency over intensity, and consistency trumps intensity every single time. Every time. Okay. So let's move away a little bit from some of the sort of guilty pleasures, and let's oh no, we talked about it. Let's talk about the book. Let's talk about the environment, shall we? Would that be a good idea, Claire? Should we talk about the environment?
Yeah, absolutely.
And I want to talk about within the context of exactly what we're saying here. So I've done some. Here we go. Let me just share my. Can you all see the dog?
Yes, now we can. I can.
Cool.
Yep.
Cool. Okay. Let's have a look at a couple of examples now of what this looks like. So you all do this. 11 litres of water estimated is used per scrub. Jump in over the top of me if you think that sounds excessive, but I don't think it sounds that excessive. 3,000 vet practices in Australia performing 20 surgical procedures a week. That's 3,000 times 11 litres times 20 procedures times 52 weeks is 34 million tonnes of water. So I Googled 34 million tonnes of water to try and find out what that looks like. I couldn't find anything meaningful, so I just left it at 34.32 million tonnes of water. I think it's extraordinary. That water's heated. If it's used for scrubbing, 80 grams of carbon emissions per surgical scrub. 30 times 80 grams times 20 times 52 is 249,000 kilos, or 249 tonnes of carbon dioxide. But you would not hesitate to turn on the tap and scrub. Now, I'm saying you don't do that, just pointing out the fact that discounting the future is so easy to do, isn't it? And all of a sudden we get to the end and that's what it looks like. So look at the next one. I've got five examples of this. Reusing syringes. So I have it on good authority that patients receive eye fluids via a single-use sterile IV line. At the end of the procedure, it's thrown. It's perfectly functional, but it's thrown out. And syringes are the same. You don't need to use a sterile IV line syringes for euthanizing patients. So in this particular practice, a mid-sized practice, 250 euthanasias per year, saves $2 by reusing the consumables. That's $500 per practice times 3,000 practices is $1.5 million in savings. Now, what $1.5 million would do for research into the environment, I'm sure would be better used than just wasting IV lines. Reducing wholesale deliveries from 3 a week to 2 a week, just getting smarter ordering. So a typical charge for delivery is $15. So you save $780. That's a good thing. 10 kilometers each way for the van is 1,000 kilometers a year. So it's half a ton. It's 15,000 tons across the industry. You can screenshot these if you want. Next one. Here's a good one. Using clotheslines to dry bedding. Not only a good way to get out and get a bit of sunshine, but alternatively, bedding can be placed on drying racks inside at the end of the day and be dry in the morning. So a single load of bedding generates 3 kilograms of emissions. So if it's just one load a day on average, you'd save 1.09 tons of CO2 per year. So multiply that by 3,000 practices, it's 3,000 tons. Costs about $1.50 per load to dry bedding. So it's a $540 saving per year as well. And the last example I've got is printer paper. So 3 vets, 10 estimates a day, 5 days a week, 52 weeks a year is 30 reams of paper, which is 2 trees per annum. 6,000 across the industry, 6,000 trees. Well, the example there is 2,500 practices, so 5,000 trees. $10 kilograms of CO2 per tree, 50 tons of CO2. That's 12 African elephants or 25 Olympic swimming pools. The annual carbon footprint of approximately 7 average Australians. So now we understand what they look like in terms of maybe some goals that we could start to think about and get some ideas going. What we want to focus on now is how habits and rituals work, because this is sort of the essence of how we actually sort of bring this home now. So what's a habit? A habit is something that happens automatically without you having to think about it. So it's automatic. There's range in thinking from up to 42 days to change a habit, all the way through until a habit is a habit until the day you stop doing it. So putting a timeline on it is a bit silly. But essentially what you want to do is try and create a rhythm or a routine, which means you don't have to think about it. It just happens automatically. So any habit that you create, and we'll think about a couple in a minute, any habit that you create needs to be supported by rituals. And the reason why that needs to happen is because if you want to create a new habit, you need to provide a mechanism for yourself to actually make it happen. So here's a really, really simple example. Then what I'd like to do is go back to these and just see what we can do. I recently had some knee surgery and I had to take anti-inflammatory tablets, and I'm hopeless at taking medication. And so I got the ibuprofen, but I had to take it every 6 hours. So my new habit was going to be to take anti-inflammatory drugs. Because I'm so useless at taking drugs, I needed to find a mechanism to actually, something to support me doing that. So I had a brilliant idea. What I did is I put the ibuprofen next to my toothbrush. So that's called habit stacking. That's when you go, clean my teeth in the morning, clean my teeth in the afternoon. There's 2 of them ticked off. They take 4 sort of 6 4s of 24. I can only take them every 6 hours. So there's 2 done. Maybe in the middle of the day, I just need to find some other way of kind of some other trigger, but it failed. And the reason why it failed is because I was in such a good habit of picking up my toothbrush that I didn't see the drugs sitting next to my toothbrush. So what I had to do was put the drugs on my toothbrush. Now, that may sound really, really pathetic. And given the fact that I'm the only man on this call, I think I am, you're probably sitting there going, typical male, but that's the reality of it. We have to create rituals to support the new habit, or the new habit won't be a new habit. You fall back into your old habit. So another really good example of a ritual is, you know, you want to go to the gym each morning, put your stuff out. Like, get your stuff out, you know, fumble around in the dark trying to find your running gear or whatever. Just get it out, lay it on the floor. So you've actually got to step over it when you wake up in the morning, and you're better than even chance of putting it on. Your alarm clock. If you have a habit of rolling over and hitting the snooze button, what chance in Hades are you going to have when you say, I've got a new habit and I'm going to go to the gym half an hour early, unless you put the alarm clock on the other side of the room? So the ritual you've got to create is something that supports the habit. And, you know, if you want to do more reading into this, just read James Clear's Atomic Habits. It is absolutely gold. It's this whole concept of forget the goal. Well, don't forget the goal. Come up with a goal, make it smart, don't make it stupid, and make it so that it actually, you know, makes sense and all of those things. But if you don't build a system to support the habit, discipline won't work. It never works, because it's too emotionally based. So you're going to find all the excuses under the sun. Even if it's very logical that you do something, the logic will go out the window when the emotional trigger kicks in and says, I don't want to do it. I'm fearful of doing it because I'm scared of it. I'm fearful of doing it because I don't like doing it, because it's going to put me out of my rhythm, or out of my routine, or I couldn't be bothered. And so when that emotion takes over, that's when discipline collapses. And so what we want to do is we want to try and create now a system whereby we can identify some new habits that we need to do in order to be able to achieve that goal, and stack that up with some new rituals that will support that. So here's a good example. If you want to stop printing and wasting, you know, what is it, 30 reams a year, 2 trees per practice, what do you think the new habit should be? Just what do you need to do differently? What's the thing that you're going to do that's going to be different? I know you know the answer to this, Katie. Caitlin?
Well, I was going to say it depends if you're talking big system. I mean, I know a lot of clinics are now going completely paperless. So having
Right.
that computer system in place,
Yeah.
so that you don't need the physical printed consent form.
Yeah.
Yeah.
So what's the old habit?
Printing it off and getting it
Okay.
signed by the owner.
Yeah, cool. So that's the habit, is to print it. So the new habit is use an iPad, or the new habit will be you can't print it, so it's on the computer screen. So turn the computer screen around. Is that right, Caitlin? Is that the new one?
Yeah.
Okay. So they can sign an iPad. So you just hand over the iPad, digital copies kept. So that's the habit, right? But that habit won't work unless you actually support it with the rest of the system. So what's the ritual to support that habit, that working?
Well, it might be not having the printer accessible, I guess, is something, yeah.
Yeah, get rid of the printer.
Making it too hard to do it that way.
Yeah. So you need a printer, right? So but put the printer out the back. So it's not, you know, so it's not easily accessible. Disconnect the printer from the server. So if they do hit print, there's going to be an error button. What else could you do? So you're looking at Practice Manager software. You're going to disconnect the print button, take it off, which EasyVet can do that. So I'm sure RxWorks can do that. Delete the print button, so it's no longer there. So you can't just click print. Get an iPad and move the printer out the back. What's another example? If we look at some of those environmental ones, let's look at the one where we're reusing the IV lines for euthanasias. New habit, going to use the IV line for euthanasia. What's the ritual?
Some sort of way of collecting the old syringes and IV lines and keeping them
Yeah,
accessible.
right. Yeah. So what does that, so let's get really, really into the detail. What does that actually look like?
Well, you use a lot for like flushing, so you could just have somewhere where those are put aside to be used later, and then you wouldn't have to worry really about washing them out.
Yeah. So what's my current habit with that?
Putting it in the bin.
Okay. So what's the ritual?
As in the new ritual, you'd have to have a
Yeah.
container there, I think, that you could throw it in instead of the bin, because you don't even think about it.
That's
so it's
it.
just having something, whether it's next to the bin, maybe even, because you'll reach
Yeah.
with a sharp, so you can still put your sharps in it, and then
Yeah. Because it's not rocket science, but it stands in the way all the time of us achieving our goals. It does. If you want to eat less rubbish and put on less weight, don't shop in the afternoon when you're hungry. Don't bring it into the house. Because if you think at 11 o'clock at night you've got the willpower to not eat it, you're kidding yourself. You're in la la land. You will eat it. The cortisol that's going through your system at 11 o'clock at night when you're 2 hours past your bedtime is absolutely craving sugar. And it doesn't matter who you think you are in terms of, your ability to be able to be disciplined. So don't buy it. Don't bring it into the house. It's not there. So then you kind of have to go to bed. A bit disappointed, but you have to go to bed and you can't have it. But the rituals go deeper than that. The rituals go as far as, when I go shopping, I buy something else because I like to have a little treat at night. So, but also even deeper again, don't shop in the afternoon, because the marketing people in supermarkets are brilliant at what they do. They'll capture your imagination. Even at the checkout, they'll have your imagination captured. Right, you're all the way through to the end and they get you right at the end. So don't do it. Shop in the morning. Shop in the morning, usually, and there's research in the supermarket industry. I know because I was a director at ALDI. There is research that says that customers do go through a certain flow through the supermarket at different times of the day. During the morning, customers go right around the outside of the supermarket and they finish at the checkout. In the middle of the day, customers don't do that. In the afternoon, they certainly don't do that. In the afternoon, they walk in and they go up every aisle. Why do they go up every aisle? Because they're attracted to go up every aisle, because they're hungry and all the crap is up those aisles. And so what do? That's what you're picking. They're way smarter than us. Mm-hmm. So that's just a really simple example, isn't it, of a ritual. Cool. Let's have a look at a couple of other ones, because I really want to try and nail this sort of habit basis. Here's a good one. So clothes going on the clothesline rather than chucking them in the dryer when you leave the clinic at the end of the day, putting them out on the clothesline. What do you think the new habit should be? Because the goal is to stop using the clothes dried, I don't know, maybe 50% of the time, maybe not every day, but we want to sort of really try and reduce the impact of the clothes dryer. What's the habit? What are you going to do? What's the new thing?
But I would say that needs to be somewhere that's not going to create extra work. So depending on your climate, if it rains a fair bit, you'd want something that's perhaps got some sort of cover over top of it, so that when you do peg it out, it's not going to get wet and cause you to have to cause you more work. Mm-hmm. And it's not going to be an oasis, but somewhere reasonably pleasant to go to.
Okay.
Safe, light, warm.
Any other ideas?
Put a basket in front of the dryer.
Yeah, that's the ritual. Let's stick that. Let's stay with the habit. What is it that you're going to do? So hanging outside may not be successful overnight. A bit of rain comes through, a bit of dew, but you can't run a hospital like that. Where could you hang it up?
Is it inside?
Yeah. Now, to hang it up inside, if that's the new habit, on a rack or on a clothesline that just pulls out from the wall, you have them at home, or you have them in a clinic. pull it out across the corridor. It's not gonna be there all day because that doesn't work. But at night time, you could, you know, those things from Bunnings, you just pull them out of the wall and hook them on the other side of the wall, and you've got a massive clothesline. So what's the ritual now? Yes, Claire, basket sitting there ready to go. Otherwise, it's too easy just to pick them out of the washing machine and chuck them straight in the dryer. So you need a basket to go into. What else?
Enough pegs. Lots of different.
Yep. And maybe the rack, the Bunnings rack, you know, or a series of racks, so that they're easily accessible. Now you've got a goal of reducing. Be nice to get more specific than that, maybe something a bit measurable, but maybe we're going to start off on every Wednesday. It's the Wednesday thing, or maybe it's the odd days, Monday, Wednesday, Friday. These are the days when we don't use the dryer. We're just going to have a crack at it and see how it goes, and then we can actually just go back and revisit it. Cool. Reducing wholesale delivery times. This is an interesting one. How are you going to do that? What's the new habit to support reducing the number of times that truck is driving 20 kilometers, 10 to and 10 away, 10 back from your clinic? How do you do that? Like, what's the habit?
Yeah, the system of being aware when things are running low rather than waiting till you actually run out of them, so that you give yourself time. Well, you've still got what you need, and you can allow for 3 or 4 days where you won't need it urgently. Yep.
So create like a better ordering system or a better inventory management system. Yep.
And you might even need to have some extra storage space, or, you know, that's what happens is if you're doing bigger orders, you're then stuck with where are we storing things. So sometimes it's just having that extra space, you know, you can store the extra supplies.
Yeah. So that's a ritual, right? So the habit, well, it's kind of, that's why it's a bit semantics, doesn't really matter. But the idea is the habit is we're actually going to order only twice a week. What days are we going to order? Let's get clear on that. So it's going to be this day and this day, whatever it is. It's going to be our standard weekly order and then a special weekly order. They're the only ones we're going to do. The rituals, in order to make sure that happens, is, you know, we need to have a piece of paper with a pen attached to a clipboard. The pen's not hunting around trying to find a pen. If you're hunting around trying to find a pen, you won't find a pen. But as soon as we find something that's missing, or we're itemizing items as we go. And as you say, Caitlin, we've got a bigger storage facility. We've actually sat down and worked out what those items are that we can buy in bulk to save the truck having to come out twice. Yeah. Does that make sense? So to summarize, it's not particularly complex, but it is a really, really important that we understand how goals work, how discipline works. I didn't touch on procrastination, but procrastination is very interesting. Procrastination is actually how Viktor Frankl would describe it. It's an emotional amygdala hijack. It's a difference between indecision and procrastination. Indecision is you haven't worked out what to do yet. Procrastination is you know what to do, you're just not doing it, despite the fact that you know it's good for you to do it. And so procrastination is one of those things where the reason why you don't do it is because you're fearful of doing it, because you don't like it. And even if it's only going to take a couple of minutes and it's done, you stuff around and you don't do it. And I think most of us are procrastinate at some point in our lives, which says that if it's an emotional state that you're in, an amygdala state, which means you're not actually pulling the trigger on something, such as creating these sort of new goals, new habits, particularly environmentally based, where you've got to go back and talk to the team about it. If you're not doing those things, and despite the fact that you know it's a good thing to do, you've sort of understand now what discount in the future looks like. You understand what consistency over intensity looks like. We don't need to save the whales in a day. What we need to do is actually just start making those tiny little steps that are moving towards where we need to get to. But you'll procrastinate. You will procrastinate, even though you know you should do it. And so how we move through procrastination is exactly the same how we move out of any sympathetic nervous state. There's only one way to do it, back into a parasympathetic calm state, and that is to breathe. So what we're going to do is we're going to breathe through procrastination. It's an incredibly powerful technique. So the minute you're sitting there thinking, I'm not sure, I've got pen and paper, I'm not sure, there's 5 things, Paul listed them, we've got the copy of the slides, got to get the team together, we have to think about this environmental stuff and the things we want to change. At the minute you think you can see yourself going, I know I should do this, but I just can't bring myself to do it because I've got too many other things to do, then breathe. Take a few deep breaths and you will push through that sympathetic nervous state. You'll reinstate your parasympathetic state and you'll actually take action. There's a nice little hack for sort of getting through that sort of any procrastination that you feel. But once you've set some goals, great, set some goals, reduce carbon emissions, new habit, a couple of new habits. We're not going to print anymore. We're going to use iPad, and we are going to do 2 orders a week, and we're going to reuse our IV lines. That's it. 3 things. Do things in 3s. The brain loves 3, right? Just do things in 3. So do those 3. Make a start. Do it Monday. But if you're going to do it on Monday, have a think carefully about the rituals that you've got to put in place to actually make it happen. Go and buy the plastic tub that's going to sit next to the bin, as Caitlin said. Got to do it. Otherwise, you're just relying on discipline and people won't. They just revert back. And the reason why they revert back is because we are perfectly set up right now to achieve the results we're getting right now because of our current habits. The habits can work for us, but they actually work against us as well in exactly the same way. We just got to create new ones. Cool. Claire, we're a bit past. You asked me to stop at 1:45 just to sort of open up for questions. Maybe people who are watching this might post questions later, but I thought about the next topic, Claire. I know you, because I know you're busting to announce that.
Yeah.
But I can share that with the group in a minute if you're okay with that.
Yeah, absolutely. But yeah, if anyone has any questions, please feel free to ask. You did a great job of interacting there throughout that, Paul. So I'm not sure how many questions.
Thank you.
We do
Thank you
tend to
guys
get,
for putting your cameras on.
we do tend to get a few questions coming in once the recording is up and people that weren't able to join are able to watch it.
Yeah, cool.
Yeah.
Well, just fire those off to me. And if anyone's wants to really understand this, read James Clear's book on atomic habits. Do yourself a favor. Has anyone read it? Sue, I can see you nodding there. Have you? Yeah, Atomic Habits. It's called Atomic Habits for a couple of reasons. First one is, the atomic, those tiny little habits. It's a sort of respect to the fact that it's not intensity. It's not like we have to do anything huge here. We just need to do little tiny baby steps. But also the sort of atomic bomb. If you do those things, you have a big impact, huge impact. We just got to stop celebrating intensity and just start celebrating consistency. That's what we've got to do. And as a society, you're up against it. Like I said, man eats salad doesn't make the headlines. But that's what gets us there. Yeah.
Yeah. Question.
Yes, Michelle.
I'm just thinking on those examples that you've given that you're also relying on everyone else buying into it. And so you're saying that discipline doesn't work. So I'm assuming just saying this is what you have to do is not going to get a lot of buy-in. So I was just wondering if you had any thoughts or comments on how you go about that.
Such a perfect segue. We should use that little question there, as Claire, as the ad for the next masterclass. But I'll give you a taste. Okay. when we want to instigate change, any form of change, we have to think very carefully about why it's important. The reason is most of the resistance for change is social, it's not technical. They're the two primary reasons why we resist change. Technical, don't know how to do it. Social, don't want to do it because it affects my life, it affects my day, it affects my enjoyment of my job. You know, people realize we've got to keep pace with inflation on pricing. In the hospital, if we don't, we're just going out backwards. Technically, yeah, I get it. Like, you know, you can explain it to me 1,000 different ways. I understand the fact that if things are costing more, we've got to charge it, pass it on to the client. Understand we don't have much money. Understand, you know, technically it's easy, right? Stick the numbers in RxWorks or any of your practice management software. It'll spit out your bill. So you don't even need to think about that. The reason why people resist doing it is because of the social impact. It's like, how's this going to affect my day? My enjoyment of my day is going to go down when I have to start explaining to people that our prices have gone up by 5 or 10%. So that's why people resist change. And so what you've got to do is you've got to overcome that resistance. And the best way to overcome the resistance is you've got to create a sense of urgency. If it isn't broken, why are we trying to fix it? That's what's going through my mind. When you come in and start telling me all of a sudden we're hanging towels out instead of chucking them in the dryer, I'm just kind of going, why? You know, we're minuscule. And then you get the cynics, you know, look what China's doing. You know, what are we wasting our time doing this for? Now, the resistance is coming from because you're now making my life more painful because I hang these things out. I get it. So you've got to really, really sort of ham it up or drive home the point of the savings. And you've got to give really good examples. You've got to get to 34,000 tonnes and you've got to draw some comparisons to that. I don't know how much 34,000 tonnes of water goes in Africa, in villages where people aren't drinking, but I'd say it goes a fair way. You could draw some examples or some parallels closer to home around the importance of this. You could even pull up a YouTube clip of people handing out bottles of water in the last drought, you know, whatever, right? You can be careful you don't get over the top, but creating a sense of urgency around is the first step. I knew a supermarket operator at Coles who was trying to impress upon his customer service team, you know, the checkout operators, how important it was that they, you know, they're only as good as their last customer because they've got to smile, you know, and they've got to be nice to the customers. And so he thought, there's 2,500 customers a day walking through the supermarket door. Every one of them talks to 11 people. That's 120,000 people a year are being impacted. So to create a sense of urgency around customer service, he got an aerial photograph of the MCG packed on grand final day and stuck it in the middle of the table, blew it up to poster size, put it in the middle of the meeting room table and said to everyone, all sat around, normal meeting. And he said, what's that? And they said, that's the MCG capacity on grand final day. He said, no, it's not. That is the number of people that are influenced by this supermarket every week. There's one store in Sydney that was losing $140,000 a week in stolen groceries. $140,000 a week. My son happened to work in the store, but he was not the thief. He was the guy that was kind of chasing people out the store, trying to get stuff back. At $140,000 a week, this store manager said, we need to do something. So what he did is he went down the road and he bought little toy semi-trailers. And I can't remember the numbers. I'll be making them up. I don't want to make stuff up. But he bought all these semi-trailers. Let's say it was 10 little semi-trailers. And he put them all on the meeting room table. And everyone sat down and go, oh, we're playing trucks now, are we? And he said, no, what do you reckon those semi-trailers represent? And he said, everyone just looked and said, I've got no idea where this is going. And he said, packed with groceries, that's what walks out the store every single week, stolen from this supermarket. And he just said, that's it. And everyone just went, holy crap. Because $143,000 to a multi-billion-dollar company, who cares? But when it's 10 semi-trailers walking out the door, full of groceries, every week stolen, it's kind of, well, whoa. So now I've got your attention. So that's the first thing. That's the first thing I would say, Michelle. You gotta hit them hard. Like, just get the facts. You've got them on these slides now, but go hard on the facts, and then find some stuff that really would resonate for people. You know, the classic dentistry. Here's a dog that needs some form of periodontal or dental treatment. We know it's got disease. We can see it. It requires some extractions, or maybe it's a grade 2, not quite there yet. Show me a photograph of a human mouth that's in exactly the same level of pain. Laminate it and hold it up in front of the client. And when you get pushback from the client that says, so my goal, right, is to increase the number of dentals that we're doing. My ritual is going to be that on every single table or whatever in the consult room is going to be a laminated picture, or up on the wall, laminated picture of a dog's mouth and a human mouth with an arrow saying equals. Because as a client, I walk in with my dog, I haven't got a clue. The dog's still eating. It's not complaining. Hasn't whinged to me yet about its sore teeth, but we know what's going on. It's in pain. So new habit, lift the lip, do the grading, book in the dental. What's the ritual? Probably going to need a laminated picture up on the wall to remind people. Or have you lifted the lip yet? Speaking of which, the sore tooth has just come on. Anyway, I'm going to touch on the rest of that. I think that's such a great introduction, Claire, to the next masterclass on how we lead change. What do you think? Yeah,
great. That sounds great. So that next masterclass that Paul is referring to will be on the 29th of April, which is a Tuesday evening, same time as this one, 7 p.m. When does daylight savings end? I think it might be finished by that point.
It is, yeah.
Double check. So watch
standard
this,
time.
Yeah, watch this space. You'll be able to register the exact same way that you register for tonight. But I'd just like to take a second to thank you so much for that, Paul. That was such an engaging and interactive presentation. I thoroughly enjoyed it. And I hope everyone did as well. And we do have quite a few more people who have registered to receive the recording tonight. So once again, thank you so much, Paul. And thank you everybody for attending.
Thanks, Claire. Lovely to see all your faces again. I know all of you, I think.
Wonderful. All right, everyone have a nice, safe evening, and we'll see you next time.
Thanks, guys. See you.
Thanks, Paul.
Bye.